Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Engelbrecht, and every week I'll be chatting here with Dr. Clifford Yudelman as we take a deep dive into the world of dental care from a consumer's perspective. So whether you're looking to brighten that smile or maybe protect your wallet, we've got you covered with practical advice and the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. And today we're talking about choosing your dental care provider wisely. Dr. Yudelman, welcome.
Thank you very much. I hope you had a great week since last week's talk about prevention, and had a good laugh at the end about there's enough potholes in the road. I didn't let you finish the rest of that, but a week later I'm still laughing about that.
That's awesome. Yeah, I have my moment to see.
Thank you very much. I'm hoping, the advice that I give today or the recommendations that people listen to it wisely. I don't want to direct people in one direction or another, but this is purely for education and some dentists listening to this, because, we're getting a lot of interest from dentists and not only consumers. I might say things that they don't agree with. They're welcome to send me an email to clifford@optismile.co.za. Don't report me to the HPCSA or anyone. If you don't like what I'm doing, let's discuss it. But I'm here for the consumer. That's what I want to say. I'm here for the people listening. I'm not here to protect other dentists, and I'm not here to run them down either. So let's see what comes out of today's podcast.
So, Doctor, what are the most important qualifications to look for in a dental care provider?
That's a great question, because the most important qualification is to actually look, if you're in a big city, and there's a dentist in a practice and they got a sign and so on, and they're operating and there's lots of people there, you can pretty much be sure that they are a registered dentist and they're not practicing illegally. But there's been a number of cases around the world, and even especially recently in South Africa, where the dentist is actually not even properly qualified, or maybe a foreign dentist, or maybe you got someone in a back street in town that pulls teeth out for people at half price. So I guess ensuring the dentist is accredited, that they actually have a valid license. You can go online on the hpcsa.gov. I'm not sure we can put it in the link, but you can put in the person's name and just check that they actually do have a license. We at OptiSmile, we don't cater to a lower economic level like that, but we understand, and this is for consumers, all types of consumers, and all over the world. There are illegal dentists, so I think you must just check that the dentist is registered. And on that note, I would also check in South Africa. We've got SADA, South African Dental Association. I belong. Most of the dentists that work for me do belong. We do have one or two that think it's the biggest waste of money. Sometimes, if SADA's listening, they must know that I actually sometimes agree with those dentists. But I do think it's important to belong to your dental association. Personally, these types of associations, there's a lot of bureaucracy and so on. But if a dentist belongs to SADA, in our case, I also belong to SAAD, SAAD, South African Academy of Aesthetic Dentistry. These are things, this is a sort of added accreditation. You should look, the dentists also by law have to do continuing education. So you can look for dentists that in their bio on their website, you can see that they've been pursuing ongoing education and training in dentistry to stay abreast of the latest treatments and technologies. And, this reflects a commitment to excellence in patient care. And then specializations, which I think we can even do a whole podcast on, which is depending on your specific needs, whether the dentist has a specific qualification or interest in cosmetic dentistry or orthodontics or periodontics. Orthodontics is straightening teeth, and periodontics is gum disease. There's a lot of different types of specialists, and you don't want to go to a gum specialist if you need tooth straightening. So we should actually make a note and do a podcast just on that.
Doctor, how does location play a role in choosing a dental care provider? And why would you say this is significant?
So accessibility is important. A conveniently located clinic can make regular appointments less of a burden, especially in emergency situations or if you have a busy schedule. Having said that, at OptiSmile, we have patients coming now from all over the Western Cape. It's not always convenient, but sometimes people come in, they get a checkup and x-rays and a cleaning and even a whitening all in one visit, and then maybe they come back once or twice for any fillings they may need, and then we don't need to see them for another 6 or 12 months. But other people say that are having Invisalign, they need to come back monthly. If they live far away, that could be a bit of a burden. If you having braces, which we don't do, we only do Invisalign or clear aligners, and it's a mother of 3 children and all 3 children are having braces, you don't want to be driving in traffic an hour and a half each way just to get an elastic changed or a wire bent. Location's important in terms of a dentist who's well established in the community. They, if they belong to a local Rotary club, such as in my case, or they've been in the community for a long time and they're involved in different charities in the community and well known, and people know them. That's important in terms of location. And for some people, if you're disabled, if they have wheelchair access, availability of transport and parking, the easier it is for you to get there, the better. I've had patients complain they used to go to another well-established practice near us, and the practice moved and there's no parking. And we've been getting a lot of patients that used to go there because we got four levels of basement parking. And for some people, it's very important. They don't want to be driving around and around or parking and walking a few blocks. It's the location. Sure, I've had a lot to say about location. What's the next question?
Location, as I say. Okay,
so the location, yeah.
So, how important would you say is it for a dental clinic to, offer a wide range of services, and why is this important?
So that's a brilliant question, especially the way things are going all over the world. Is you're getting more and more group dental practices, and what that's led to is comprehensive care, like a clinic that offers a broad spectrum of services, more holistic care, addressing various dental issues under one roof without needing to be referred all over town. There's a convenience and time saving. It saves time and avoids the hassles of visiting multiple specialists at different locations, and continuity of care. If you've got a single team that manages all your dental needs, there's better coordination and a deeper understanding of your dental history. So that's not very common in South Africa, but in Cape Town, there's maybe 3 or 4 other group practices similar to OptiSmile. If you go to just a single dentist, they may not have all of the fancy equipment that a group practice can afford. For instance, a CBCT, which is a fancy X-ray machine that does 3D X-rays. It's a 2 million rand machine. If you buy a cheap one, it's maybe 1.5 million rand. And a single dentist in a practice just can't warrant, having this machine, and maybe will refer a patient, every so often for one of those X-rays. But as soon as you've got 3 or 4 dentists practicing together, there is a sort of economy of scale, and in the case of OptiSmile, if we do a normal panoramic X-ray and someone needs a CBCT, we actually take that X-ray at no charge. Another dentist, you may pay as much as 3,500 rand for an X-ray like that. If you're in a small town and you get referred to a place that does those X-rays, so there is some savings in going to a group practice that has all this fancy equipment.
And doctor, how do advancements in dental technology impact the patient care and the outcomes?
So like I just mentioned, you've got improved diagnostics, advanced imaging techniques for earlier and more accurate detection of dental issues and more timely intervention. Sometimes I do an X-ray on a patient and then I want to do a 3D X-ray, and I always tell them, I'm going to do this X-ray because I want the information on the X-ray more than I want your money. So do you mind if I do a 3,000 Rand X-ray at no charge? And no one's ever said no. And then we run it through AI. We've got something called DiagnoCat that reads the X-rays, and it really helps us to find problems a lot earlier. You end up with less invasive treatments. Modern technology can offer less invasive options for treatment. Things like injection molded composite bonding. And, if you've got a 3D scanner, we'll do a technology podcast, I think, in the future, talking about these different technologies. That's actually a brilliant question right there. If you need an implant and the dentist doesn't have a 3D scanner or a 3D X-ray machine, they can't do guided surgery. Take a scan of your teeth. It's like a 3D mold of your teeth and a 3D X-ray. And then on a computer, we can design exactly the length of the implant and where it needs to go. And 3D printing, we can print a little guide, and you could literally put the implant in with your eyes closed, although I wouldn't recommend it. And we get better results. I wouldn't say better results. There are dentists that don't have any of this that have been doing amazing work for the last 20, 30 years. But the innovations in materials and procedures contribute to in our case, better patient satisfaction and we think a better outcome. We love our advanced dental technology. Our tagline that we've now trademarked is leading digital dentists. That's how much we've actually embraced dental technology at OptiSmile.
What level of experience should a patient seek in a dental professional?
Oh, that's a great question. So, if you've never had a cavity and you've been going to the dentist and all you need is a clean, and you floss your teeth every day, and every 3 years you get X-rays and they never find cavities. You could go to a dentist that's fresh out of dental school or, just finished their ComServe and they're working in a medical aid practice. You don't have to go to a dentist that's got years of experience because you've looked after your teeth or you haven't had a lot of problems. But the more complex your mouth is and the more dentists you've seen in your life that haven't been able to sort you out, the better off you are with seeing someone who's got insights that they've gained from a broad spectrum of cases and the diversity of cases handled, experience with a wide variety of dental conditions and treatments. In my case, there's a lot of things I don't treat, but at OptiSmile, I've done something that they recommend, hire people that are smarter than yourself. And there's many days that I live vicariously through the treatment that the other dentists in the practice do because, personally, I can't handle blood. I won't do an extraction or a deep cleaning or a root canal, but I've got people that do that. And you need someone that can do the stuff that you need done.
Yeah.
Depending. Yeah. And the other one is like patient outcome. Look for, ask people, read Google reviews or testimonials. Yeah. For me personally, I don't believe in before and after galleries. I think, I'm not saying it's a scam, but I've got a lot of great, after pictures of things that we've done that worked out well. But I think even like the HPCSA and other dental authorities look down upon inciting or inducing people to self-diagnose by showing before pictures and then these great outcomes afterwards. But definitely read through, if someone's got Google reviews, read all of them. Take your time. Just look. Sometimes you can see if it's not a genuine review, and that the reviews are fresh. I think that's important.
And here I thought dentists were not allowed to be scared of blood, and that's very, very interesting. Moving on, Doctor, in terms of reputation, what would you say should we look out for when we select a dentist? What kind of indicators?
So, if you do see a dentist and you think, and you're unsure, ask your friends, check the HPCSA, make sure that they haven't actually been struck off and still practicing without a license. I think that these days, Google reviews, if a dentist is on Hello Peter, that can't be good. Generally, people only put really bad reviews on there.
Yeah.
So you could look at Hello Peter. I think I've got 3 reviews on Hello Peter and they're all good. So thank goodness for
done.
that. If the dentist has got a few things like they belong to SARD or SARDA, professional endorsements, these days LinkedIn would be a good thing. Just check that they're friendly with lots of other dentists. If a dentist isn't on LinkedIn, I think that could be a bit dodgy these days.
Mm.
And then transparency and communication, a good reputation for clear, honest communication with patients about treatment options and costs. If every review just talks about the wonderful ocean view or how cheap the dentist was or something that doesn't relate to what it is that you're looking for, I think keep looking.
And how can patients assess the affordability of a dental care provider without obviously compromising on quality?
Oh, that's a tough question. If cost is your very main concern and you do have medical aid, there are some medical aids. I think there's something called, GEMS, and then there's different government and police types of policies. There are some medical aids that actually pay providers really well to do good treatment, and they have things in place to check on the quality. And if cost is your main concern, then I would recommend maybe going within your medical aid. If you got a complex situation, then and you do go privately, like if you did come to OptiSmile, I would get quotes up front, make sure that there's a transparency, that you get upfront quotes and that you can make informed decisions. And then before you go ahead with treatment, check with your medical aid. Don't presuppose they're going to pay 100% of something or 20% of something. Don't commit to treatment that you maybe can't afford. In the case of things like Invisalign, some practices like OptiSmile, we have payment plans on expensive treatments like that, or pay as you go. If you get an implant placed, you can pay for the implant, and then in 3 or 6 months' time, when you get the crown, you can pay for the crown. And then also value versus cost, assessing the long-term value of treatments such as the durability and the effectiveness, rather than just always going for the cheapest option up front. Like, don't go and get your tooth pulled if you can't afford an implant, or the dentist is talking about giving you a really inexpensive bridge, and then that you end up filing down other teeth. So I think we've probably covered that.
Now, Doctor, apart from the dead fish in the tank in the waiting room and maybe some screams coming from the next room, any other red flags that might indicate a dental care provider is not the right choice? Any other red flags you can share with us?
Yeah, so if a dentist keeps you waiting a long time, excessive waiting times, either having to wait 6 months for an appointment, the guy might be the best dentist in town, but if you got to wait 6 months, in the meantime, your tooth is hurting, don't wait too long to see the dentist. If you're waiting too long in the waiting room, it indicates overbooking or poor practice management. If you're going on the medical aid, they tend to double book things because a lot of people don't show up. And so, you kind of get what you pay for there in general, but they are very well run medical aid practices. I have a friend in Durban that owns 10 or 12 of these practices, and although it's medical aid, they've got a very good reputation and they do a very good job. Any kind of pressure to undergo unnecessary treatments, a dentist who pushes for treatments that seem unnecessary or excessively expensive, they may not have your best interest at heart. And then lack of cleanliness or outdated equipment, if the office is unkempt, or you're worried about the hygiene standards, I would run. That's a must, especially after COVID. I don't know. Mm-hmm. There's other things you can catch at the dentist, which, that I don't want to really go there today. Maybe once we've done another 50 podcasts and people are not like shooting me out of the water, I think I can do something about that. But yeah, if there's a dead fish in the tank, run.
Yeah, I think that's not a good thing. Eh? And how should a patient approach choosing a specialist? Were you talking about orthodontist or a periodontist within the general practice?
Generally, it's not a good idea to self-diagnose and go straight to a specialist. We see a lot of people who've gone, their teeth are crooked and they don't have a general dentist and they go straight to an orthodontist. And the orthodontist lines their teeth up, as orthodontists do. But the orthodontist hasn't taken into consideration the wear and tear on the patient's teeth. I'm talking more in the case of an adult. And then the patient's teeth are straight. They've straightened up the biting edge, but the gum line doesn't line up. And then they come and see us, and then they need to either have further orthodontic treatment or get gum surgery, and then they're stuck with getting veneers as opposed to doing it the other way around. I think you need someone who is your main port of call. You need a very good general dentist that knows about all the specialties and that works hand in hand, that will call the specialist and make the appointment for you, or send you an email and copy the specialist and send all the x-rays and be very specific when they recommend. If you get referred by a dentist to a specialist that they work with, and it's not just their cousin or their uncle or their friend down the road, you can be sure that they've chosen that person because that person makes them look good. And when that person's done with any specialty treatment, they will send them back to the general dentist to complete any treatment. And then I always recommend to my own patients, if I send you to an oral surgeon to get your wisdom teeth out and for some reason you don't click with that oral surgeon, or if you need a gum graft and you don't feel happy, it sounds too expensive, or you want a second opinion, if you're going to be having any kind of surgery or anything that's going to take 2 or 3 years to do, by all means ask your general dentist for another referral. If you've had your x-rays and your scans and everything done, and it's just a question of sending them on, you own your records. If you've paid for them, even if you haven't paid for them, you own any records that have been done. And you just ask your dentist, please send my records to this specialist or that specialist or to another dentist. As I say, if there's something that they've done and you're not happy, they can't withhold any of your records pending payment. If you've put in a complaint for one reason or another, it doesn't matter. Your records belong to you.
And then finally, what questions, Doctor, would you say should patients ask during their first visit in order to evaluate a dental care provider?
Oh, brilliant question to end off with. So I think you should ask the questions before you even go to the dentist. And the way to do that is to look through the website. Websites should have FAQs or frequently asked questions. If you go on their Google page, I forget what it used to be called, Google My Business. It's sort of on the Google Maps. There's a lot of places where people have asked previous questions and the dentist should have answered them. I would also check out their social media if they've done specific reels or educational. If there's a lot of educational material on their Instagram or Facebook, fact, we can even do a nice podcast all about that, the pros and cons of using social media for picking a dentist. But if you are at the dentist, treatment options and rationale, ask about different treatment options and why certain recommendations are made, so that you can understand the whole treatment plan or care plan fully. Emergency care policy, ask about procedures for handling dental emergencies outside of regular office hours at OptiSmile. If you phone our office after hours and you are a registered patient, we have all of the dentist's personal phone numbers on there, and our patients all have our personal numbers, so they can WhatsApp us, even if it's a simple question. But very few dentists around the world do that. That's the way we roll. And preventive care guidance, ask for advice on improving your dental hygiene, preventing common issues, and look out for them being more about, helping you to help yourself, as opposed to like looking in your mouth. Oh, you need 3 fillings, make an appointment. You go in, they do the 3 fillings, and they say, okay, come back in 6 months for a cleaning. If that's what you're looking for, then by all means. And if you got a very low end medical aid, and that's the only thing that time allows for, then maybe consider going out of your plan to a private dentist and just paying a bit more if you can afford it.
And that wraps up another episode of Save Your Money, Save Your Teeth. Dr. Yudelman, thank you so much once again for sharing your expertise with us. We really appreciate it.
Thanks for your fantastic questions. I always worry that you're going to catch me out, but so far so good. I seem to have all the answers. It doesn't seem like we're running out of things to speak about, and I look forward to next week. Thank you so much.
Thank you. Yeah, I've had a little help with the questions, but I won't say how. But anyway, also a big thanks to our listeners for tuning in. And also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And also don't forget to subscribe for more enlightening discussions. And do join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.